I'm Dr. Kim Crosby. We're at Harmony Medical Spa, and I have volunteered to be the patient for a demonstration of microneedling. This is one of my favorite procedures. I love it because it treats everything from the hairline, full face, neck, décolleté, if you've got any little scars, fine lines, wrinkles, pigmentation issues, it treats everything. So Mackenzie's doing the treatment today, and Kayla is filming. And we're just going to talk a little about microneedling while she gets started. Alright. So before this, my face was washed and I was numbed with a lidocaine and tetracaine compound. I was numbed for about 30 minutes and I literally cannot feel anything. I can't feel if my eyelids are open or closed, except to know that my eyeballs are looking out them. So I know a common question is, does it hurt? Because it looks like it would hurt, it's the whole idea of it sounds like it would hurt, but I honestly feel absolutely nothing. There's a vibration sensation that you can feel like on the bone of your forehead, but I literally feel nothing on my skin. I really like the treatments to be aggressive. Mackenzie knows that, so she's probably a little more aggressive with me than she is with the average client. But if I'm going to do this, go big or go home, you know? So, microneedling, we started doing it probably 8 or 9 years ago. The idea started because plastic surgeons would sometimes not like the way a scar would turn out. And they learned that if they took a tattoo gun or a tiny little needle and they made needle holes in the scar, that they could make the collagen remodel. So then someone smarter than me, said, well, instead of doing a facelift, why don't we just stick little needles all over the face and remodel the collagen and skip the surgery? And microneedling was born. So the first microneedles technique was done with rollers, and you can get these cheap rollers on Amazon. They're not a good idea, but you can find them on Amazon, and that's the very first microneedling that was done in spas and salons. Since then, these devices have evolved, and the device has a disposable tip. This particular one has a 12 microtine tip that's adjustable to a fraction of a millimeter. So, for instance, the skin is thicker along your jawline and on the lower face than it is around the eyes. So she adjusts the depth of the treatment to the treatment area. I love it around the eyes. It's the only thing you can really do in that under eye area that really treats the fine lines. It stimulates collagen. I just stopped talking so that she could get really close because I want her to get really close to that lash line. And I always have her pull up the eyelid a little bit and treat the upper eyelid. It gives a nice little lift to the upper eyelid. And I'm telling you, I know it looks like it's painful, but I feel absolutely nothing. Get under your top eyelid. So when we first started doing microneedling, we would use synthetic growth factors and different things that we knew would help the body to make collagen, copper, peptides. The growth factors back then were about 40% pure. Then we got better at making synthetic growth factors, and we have a synthetic growth factor serum that's over 95% pure that is an option. But today we're using my own growth factors. It's called PRP, or platelet-rich plasma. A treatment similar to this was made very famous by Kim Kardashian. The particular one that she had was called a vampire facelift or vampire facial. The basic idea is that your own personal growth factors are concentrated in your platelets. So you can draw the blood and separate out the platelets, and when those platelets are reapplied to the skin, they will degranulate, releasing all their growth factors. And that's what we're doing today. So what she's applying to my skin is my own blood, my own platelet suspension. And it's rich in growth factors and gives a much better treatment. I've decided to do this today rather than the synthetic one. Sorry, I know I'm talking a little unclear, but my mouth is so numb. I think in the old days, it would probably take 3 treatments with the synthetic growth factors to get the results that we get with one treatment with the PRP. And it is a little more expensive to do the PRP, but the results are so much better that I think in the long run, it probably ends up saving money because you end up doing fewer treatments. Don't you think?
Yeah.
We still have a few people that will select the synthetic growth factors, but I would say probably 90% of our clients now go with the PRP just because the science is better and the results are better. So y'all aren't seeing me at my best right now, but I'm 53. I really don't have a lot of wrinkles, and I really give the credit to this type of procedure. And Botox, of course. So Kayla's doing our filming. Kayla, what kind of questions do people have when they call about this procedure?
So a lot of our clients ask, does it hurt? Dr. Cosby says, no, it doesn't hurt. It's painless. You are
Completely.
so numb, you do not feel a thing.
My client earlier said it was relaxing. Just the sound of this machine and everything.
So no, it does not hurt. A lot of our clients will ask, how long does the procedure take? We ask you to arrive 30 minutes prior to your appointment. We get your face cleansed, we numb you, we will draw your blood, spin it down in the centrifuge, and then Mackenzie or Melody will start your treatment. So you can plan to be here about an hour and a half total.
And absolutely don't plan on going anywhere afterwards. You will be a hot mess. But by the next day, you will really look fine. So tomorrow, I will put mineral makeup on and come to work, and my guess is no one will know I had anything done. As bad as it looks, by tomorrow it really will be completely unnoticeable. Hard to believe. So we had one client that, even though we tell people not to go anywhere, she left with her mask on and she went to the bank. I'm sure she got more than a few raised eyebrows, but really when you leave here, just plan on going home. You'll leave with a little mask on that helps to kind of soothe the skin and take a little of the inflammation out. After the procedure, the numbing lasts for probably, I'd say, close to 3 hours. And after that, the skin feels a little tight, but it doesn't hurt. You don't feel uncomfortable. There's no real pain associated with it. The skin isn't tender. You do not wash your skin on the day of the procedure. You just go home with the mask on. You wait, is it hour and a half? Or
Yeah, 45 minutes.
Okay, 45 minutes with the mask. And once the mask is removed, you just don't put anything on your face. We do send you home with a post-care kit. And there's a night hydrating cream that's really very comfortable, feels good on the skin. Oh, by the way, don't go over that big mole.
Okay.
So I'll tell you how numb this is. I can stand to do this without flinching, which is truly remarkable because when I go to the doctor's office, I flinch just when they do that little puff of air to check your eye pressure. Makes you want to sneeze. So in addition to the fine lines and just overall improved texture to the skin, I will mention that I noticed my pore size improved, particularly the pore size around my nose. Nothing really made a difference with that. I tried every chemical peel known to man, and all those things helped a little, but this is the one thing that really made a difference in the pore size. And all you young girls don't really know, but when you get old and decrepit like me, you start to notice that your pores look huge, and you just hate the way that the makeup falls into the pores, and this makes a big difference. Melody and Mackenzie both had special training to do this procedure. This is not something that you want to let someone who's untrained do on you. It's best to have it done in a medical setting. And the preparation of the platelet-rich plasma is not the same across the board. So in a lot of offices, they use a PRP kit that draws either 9 cc's or 12 cc's of blood. We use a very sophisticated kit that draws 30 cc's of blood, and the platelet collection rate is very high. The percentage is over 90%. I'm not good with numbers. I don't remember exactly what it is. But you harvest a lot of platelets, and so therefore your treatment is much better. It makes a big difference if you're working with 6 million platelets or 30 million platelets. So I've got a small scar on my chest. I don't know if you can see that, Kayla. It's like a little cross. And she's going to be a little more aggressive over that area and do what's called stamp over that area. And that will help with the appearance of the scar. So anyone who's got little scars, you know, from a previous biopsy on the face or childhood scars, like, you know, when kids fall and split under their chin, those kinds of little scars that have always bothered you. I saw a girl the other day who had a nasty scar in her eye area from a car accident as a young woman. The appearance of all those scars gets much better with microneedling. And it can be used for hair restoration too. We have several hair restoration clients who come in, and it's a similar process. It's a little more difficult to numb the head, of course. For men, if they have large bald areas, you can apply the numbing cream. For women who are just doing it for thin hair, we typically just give a little sedation. The PRP is highly effective for hair regrowth. We tend to use a double kit for PRP for the hair growth, so it's a 60 cc blood draw rather than 30. I don't think we've had anyone who hasn't noticed substantial regrowth of hair.
I didn't know about this hour. Take it off.
Ooh, can you do the scar too?
Oh yeah.
Okay. So one thing that we learned is that the numbing cream lasts long enough that, like, you can go back to an area that you missed like this and not feel a thing. But if you go back over an area that has been treated once already, that you feel, I can assure you. We learned that the hard way. So now they're very sequential about doing it. They never go back over an area that's been treated already, and it is a completely painless procedure. Are we good?
Yeah, I'm gonna do like the top of that one more time.
So if you can tell, a lot of our clients think it's scary thinking about getting your blood taken and having it microneedled back into your skin. As you can see, she's red, obviously. She's got a few little, you know, spots where you can see some blood. It's not scary. People think that you're going to be covered in blood. You're not.
Oh yeah, they Google it and see all the pictures.
What are you rubbing onto her skin?
This is just some of the leftover plasma she had.
That stuff is like liquid gold. You don't want to waste a bit of it. Now it does feel kind of sticky on your skin. And after she's completely finished, then we'll put an LED light in. We know that certain wavelengths of LED light will help to drive that in and help to decrease the inflammation. So as red as I am now, after 30 minutes under the LED light, I'll be much less red. And then a mask is applied at the very end, a post-procedure mask that's hyaluronic based, and it just really makes everything soak in deep into the deep dermis. And that helps as well. And then our clients leave with that mask on. So it's not like you leave looking like this.
So after your procedure, how long would you say that your results are going to last?
Well, it takes about 6 weeks to build collagen. So you will see an initial tightening within the first couple of days, which is just the initial reaction. But then to really see true skin improvement, it takes about 6 weeks. Once you build that collagen, as long as you don't do anything that breaks it down, smoking, a lot of sun exposure, you will keep that collagen for 5 to 7 years.
And then how often do you recommend clients having this procedure?
Okay, so typically they say 1 procedure for every decade of life. So if I had never had one and I was an average 50-year-old, I might need 4 or 5 of these to get started. I just do 1 a year. But in the meanwhile, I'm doing other things that keep my skin looking good. Hydrofacials and chemical peels and things like that. And of course, using really good home
For your
care.
eye things.
Yeah.
Don't want to mess up her lashes.
Yeah, don't mess up my fabulous lashes.
Which you can also get at Harmony Medical
That's
Spa.
correct.
Okay.
So this is just protection for the eye, the LED light. You don't want to have that on your eyes for 30 minutes. And maybe you can tell about the post-care, Mackenzie.
Okay, so she's gonna sit under here for about 10 minutes, and then I usually gonna go to the post care, fill out some notes. But Yeah, so she will go home with everything she needs. There'll be a full aftercare sheet, step-by-step instructions. So she's going to go home tonight and not really do anything tonight. She's going to wear that mask home, which she doesn't have on yet. She'll keep it on for about 45 minutes. When she gets home, she'll take it off. If there's anything left on her skin, she'll just like rub it in and just go to bed. The next morning, she'll get up. She'll use the cleanser that we send home. She'll cleanse her face and then use the serum that we also send home. Put that on, and then she's going to put on her cream and then SPF that you also get. So you're going to have everything you need for at least the next 7 days, and you can use it until it runs out. And then at night, obviously, you do the same thing, except don't use your sunscreen. And that is the aftercare.
Alrighty, so we're going to let Dr. Crosby sit under the light. She's going to get her mask, and then she will be good to go.
Yeah. And then if you guys have any problems or questions or anything, you can call us. Call the spa.